are monitoring ozone, nitrogen dioxide, particulate matter. And one thing I want to point out here is that these are scattered. So if you look at the scale up in the upper right, you know, those stations are several kilometers or up to 15 or more kilometers apart. And so for this study, what they did is they used all of those measurements to come up with an average that represents what people in this area are exposed to. And I bring this up because these are different kind of studies. They're not the usual kind of experiments. So I want to just point out we're talking about areas. We're not talking about the block of their neighborhood, right? We don't have that fine level of measurement. So in these kinds of studies that we're going to spend a lot of time talking about, what the researchers will do is they'll have these monitor data, or they'll have satellite measurements, or they'll have complicated models that are kind of like forecasting the weather. And they'll use those to get some measurement of air pollution. And then they have some...
Can you say what 15 kilometers is in miles? Or?
Oh, sure. It'd be about 7.5 miles. It's 1.6 kilometers.
10 miles.
Sorry, 1.6 kilometers to a mile. Thank you.
Say that again.
Just under 10 miles.
Thank you.
And so in all of these studies that I based the next analysis on, along with getting some estimate of pollution, the researchers look at some health effect or health outcome. And so asthma is a good example. And this was a study of asthma. So if you look at how many people went to the emergency room for asthma, say at like South Shore Hospital, right? So what you can do is look at how the levels of air, the concentration of air pollution goes up or down, and then you can look at how many people are going to the emergency department for asthma attacks, either the day of a spike of air pollution or within a couple of days of a spike of air pollution. And by doing that kind of complicated analysis, these studies come up with a relationship between increases of air pollution and health outcomes. So if the particulate matter or ozone goes up by 1 unit, then we see a certain % increase in emergency room visits for asthma attacks. And we'll see why this, I had to go into a lot of detail to explain the logic behind these studies. All right, so if we I just put up a handful of these studies as examples. Nitrogen dioxide, if you look at these studies, a unit increase of nitrogen dioxide is associated with increases in hospitalizations for respiratory disease and heart failure. Carbon monoxide, which also is produced by compressor stations, associated with increased premature birth weights, low birth weight. Sulfur dioxide, which is less of a problem for compressor stations, low birth weight, heart failure, particulate matter, fatality from heart and lung disease, new childhood asthma diagnoses. So this is why those studies are important to look at, right? Because those are our link between air pollution and health outcomes.
This list of pollutants are exactly also the pollutants that are emitted by almost any internal combustion engine, meaning cars. So basically, if you live near a major highway, the same exposure. Now, really, the problem here is that a compressor is a big pump, and you have to power it somewhat, and you're using an internal combustion engine powered by their own dirty gas to drive the thing. Couldn't they solve the problem of putting an electric motor on it instead to power that pump? I mean, that's just one.
Right.
Thought. I don't know if there's any merit, but I just
put this in. That I haven't. That does come up on occasion. There are electric versions of these pumps, but they are rarely used. And my casual assumption is because of the cost savings. So there is the Kinder Morgan pipeline. The current proposal would put an electric compressor at one site along the pipeline route, and it's not clear to me why they put one there. Yeah, but you're right. These are all the things. Part of why we know a lot about them is because this pollution is created by burning fossil fuels in general. So this is the kind of information that we can apply to the pollution coming from the compressor station. Sorry, how about I'll answer one more question, and then is it possible that we could save them to the end?
Oh, all right, sure.
I can answer yours.
Okay, well, you're saying this is going to be some proof to give, I don't know how you put it, but, just to show people that it's harmful. But I think that the money is going to be more important. And the bridge, if there's any damage to that, the government's paying a big amount of money for the bridge. If it ever gets damaged, they have to replace it. I just wanted to give that suggestion.
Well, the focus of the talk tonight will be on health effects, and I think the question-answer period, if we can get through the health questions, we can bring up general points about it, which are very valid and important to keep in mind that everything with the health is just one aspect of the project, and there are a lot of other things. But I do want to make sure we get through it, and it's kind of complicated, so I'll just ask if it's possible to hold the questions to the end. Okay, so I just went through showing you what public health studies of air pollution look like. And the reason is because these provide us with an estimate of how health outcomes change based on changes in air pollution. So now what we need is the concentrations of air pollution how concentrations might change based on this project, right? Just like we did for formaldehyde. A ton of nitrogen dioxide doesn't mean anything in terms of these public health studies. We need to know concentrations. But that's exactly what had to happen for Spectra to file their application for this compressor station project. They had to list what they think the concentrations will be after the station is built and it's operational. So they start with the same basic information about the compressor engine and how much pollution it's producing each hour. But then they use forecasting and modeling, kind of like you'd forecast the weather. And they come up with this concentration. And what they did is they say, well, we'll look out at 10 kilometers out from the station, which again, I'm not going to think up the math offhand, but it's on the order of 6 miles?
Yeah, 6 miles.
All right.
Yeah.
And so the one piece that we're missing is they're not very clear about, is this going to be the concentration for the entire 6 kilometers, or will it be higher near the station and decrease? That simply isn't included. It's not part of the application. And so as somebody who wants to avoid bad health outcomes, what I consider is the area, that 10-kilometer area they talk about in this project is, in my mind, the area at risk. And we simply don't have any better information than that. Okay, so here, this is a table for one of the pollutants, nitrogen dioxide. It's this 1 hour standard, which is really not very particular for us. But this is how they say the concentration of nitrogen dioxide will change under these different operating conditions from our compressor station. So we're looking at between 10 and 14 micrograms per cubic meter. Okay, so now this is the point where we can combine this information from the company along with what we know from public health studies. And of course, this is the company hired consultants to prepare these numbers. I don't know how accurate they are, if they've kind of fibbed things so that the numbers look better. I mean, this is just the best that we have, so that's why I'm working with it. So we're putting these things together, and what we can say is, well, the company said under kind of a higher operating conditions, nitrogen dioxide around the compressor station will go up by this number, 14.5 micrograms per cubic meter. So if we combine that with unit increases from those public health studies for asthma, new diagnoses of childhood asthma, I would expect or predict based on what the data that I have in front of us to go up by 7.5%. Right? And again, is that right at the compressor station? Is it going out for the 6 miles? It really, I don't think anybody knows. But I really think that we need to consider the possibility that the nitrogen dioxide is going to spread more than just a few blocks from that compressor station. That being said, this number here, 7.5%, is the very beginning of this analysis. All right? We've spent a lot of time in the last 5 or 10 minutes talking about the background to get us to this number. All right? New diagnosis of childhood asthma. Okay, this does not sound good for anybody, including me, because I take care of children from the Quincy area. But once you've been diagnosed with a chronic health condition like asthma, you need to go to the doctor, right? And if anyone here has asthma, you know, you may have to go and get refills. You may have to, you may have a minor asthma attack and you need to see your doctor. They want to check in on you and make sure you're doing okay. So clinic visits, again, based on published studies, if this is the increase of nitrogen dioxide we would see, I would expect clinic visits for asthma, and this is for all ages, to go up 4.8%, okay? So this is if you're practicing in the area like I am, all right, well, there's going to be some increase of clinic visits. So asthma, this is going to be important in our future. And if you have a chronic disease like asthma that's not well controlled, sometimes you have an emergency, you have to go to the emergency room. All right, and emergency room visits for childhood asthma, again, the same logic, increase 4.1%. Now, most people, you go to the emergency room for an emergency, you get treated, you get to go home. But if you're really sick, you end up hospitalized. And of course, hospitalizations for asthma increase 2.4%. And I just put in a couple of other conditions here, chronic obstructive pulmonary disease, increase 7.2%, again for the same increase in pollution. Strokes, 4%, heart failure, 7.2%. So the thing is, when you're sick enough to get in the hospital, again, most people will go home, but the reality is that some people will die in the hospital. And of course, if the pollution goes up by this amount, based on what's been published on nitrogen dioxide, I would expect death from heart and respiratory diseases to go up as well. And this is because, I mean, we didn't talk a lot about what nitrogen dioxide is, what particulate matter is, and it's because there's really a lot of material to get through tonight, but these are all toxic, right? I said that before. These are regulated by the EPA, and that's for a good reason, because they're clearly associated with chronic disease, attacks of diseases like asthma and death. So this is just the beginning as well, all right? So we walked through for one disease, asthma. Is this the only disease affected by air pollution? Is this the only kind of pollutant coming out of a compressor station? No. All right, so what I'm trying to do now, what I've started doing for this talk is trying to come up with a systematic way to estimate the health effects from something like a compressor station. And so what I've started doing is cataloging the public health studies that I review, and I select only those studies whose methods of measurement and the results that they obtain are relevant for our situation here in Weymouth with the compressor station. So some studies have their own way of measuring something that doesn't, it's like comparing apples to oranges. So I exclude those studies, or some of them are done at times or places where the amount of pollution is really high, and those studies would not be valid to apply here as well. Now that being said, these are general estimates because there are some assumptions that go into this kind of analysis. And so the more of it we do, the more assumptions we have to make. And so I'm presenting these numbers as a general idea of how health outcomes might change. And there are a couple of things that we can learn from it along the way. So first of all, for particulate matter, out of the studies I reviewed, and I've clearly not reviewed all the studies, as we might expect from what we talked about, diagnoses of pediatric asthma up 3.8%. But surprisingly, neurologic conditions like autism, Parkinson's, Alzheimer's have also been associated with particulate matter, including 2 recent studies in the last year from the Harvard School of Public Health. So this is not fringe research, all right? And again, doing that same kind of analysis that we just walked through in the last few slides, increased diagnosis of autism from the particulate matter coming out of a compressor station, and faster rates to hospitalization for Alzheimer's, Parkinson's disease, and more hospitalizations for heart attacks. Turns out, just like formaldehyde, nitrogen dioxide is a bad problem when it comes to compressor stations. It's probably more of a problem than particulate matter. And so what this table shows is the combined particulate matter and nitrogen dioxide numbers. Now if we put them all together, starting up in the left, diagnosis of asthma, diagnosis of autism, clinic visits for asthma, respiratory cancers, chronic obstructive pulmonary disease, even diabetes, hospitalizations, up for all of those diseases as well. And then the final column, the ultimate health outcome of death, would go up, I would expect to go up as well, based on these increases in pollution. And these are the numbers, again, that I get by combining the public health studies on air pollution with the numbers in the application from the company. This is why these pollutants are carefully controlled by the EPA. They're quite toxic. And again, you might say, well, how does diabetes have anything to do with air pollution? Asthma, COPD, lung cancer, sure. But the thing is, particulate matter, I didn't even explain what that is, I just said it. Particulate matter is a category of air pollution that is microscopic, basically like microscopic particles. And the reason they're harmful is mostly because of their composition. And so particulate matter can be composed of heavy metals like lead and other things, can be composed of organic compounds, which as we've seen are toxic and cause cancer. And all of those things together produce inflammation in the body. And so particulate matter can get deep in the lungs, it gets absorbed there. Other pollutants can get absorbed through the skin as well, through inhaling contaminated dirt. And that's why even something like diabetes that seems like it has no relationship to air pollution is very consistently identified as affected by air pollution in a number of studies. And then if we get all the way down to the bottom right corner, all non-accidental death. And this is from a study that basically excluded car crashes or workplace accidents. And so those are medical deaths from medical causes that were associated with air pollution. And those, again, applying that same approach, I would expect to increase 4.4%. If the station is approved and built and operated under the conditions in that application. But now I have to point out, right, don't forget, this is the first round of the compressor station because they've already started preparing the expansion, which would more than double the amount of pollution coming out of that station because the horsepower will go up. There'll be another engine bigger than the first that is going to be burning more gas and creating more pollution. So we have to adjust this table and account for that. Those numbers will be actually higher if that station gets expanded. And let me tell you, from working with people in Rhode Island, they have a station that's been there since the 50s or 60s. That station is going through several upgrades in each of these same projects, and they keep taking out the old engines and putting in the newer ones. They get bigger. The capacity of the compressor station gets bigger because these companies are making money by shipping the gas. The more they ship, the more money they make. And in the meantime, what's happening in our communities? All right, now if we do this analysis for these two types of pollutants, asthma, autism, clinic visits, hospitalizations, deaths, you can see these are pretty significant numbers. And these are not an exhaustive review of public health studies of air pollution. I mean, you can imagine what an effort that would take, right? This is just what I've been doing in the time that I can put together as an initial approach, all right? But there are several lessons here. The first is that there are a lot of diseases that are affected by air pollution, all right? That's something that I think most of us probably didn't think about, and I didn't think much about before doing this work, but it's really many, many chronic conditions are affected by air pollution. And the other thing is that it's not just, if you think about asthma, attack, it's a lot more than that. It's the diagnosis of a chronic disease, it's the clinic visit for a chronic disease, it's dying from a chronic disease. These are all affected by air pollution. All right, so that really, I think, is the most complicated part of the talk, and probably the hardest to get through and make sense of, but I think a very important part. The last thing I'd like to do, I'd like to mention one thing that I don't have a slide for, which is part of this application is that the state required this company to also do an analysis of the concentration of air pollution from the existing sources in the Four River area. So if people know what's around there, there's the old Calpine plant, there's the Braintree power plant. There are a couple of other facilities that the state required them to account for. And so, these are the numbers that are just from the compressor station. But if you look at their Spectra's application and how much pollution they say is already in the background just from those other sources, before this thing even gets built, there's a lot more nitrogen dioxide in that area than what would come from the compressor station. All right, so this you know, it just, there's a lot to talk about, so I didn't have the chance to make this point very clearly, but I really want to say this, that communities around the Fore River are already bearing a burden from air pollution. So it's not just what's coming from the station, but what people are already dealing with. And then on top of that, because of this site they chose to put the station right there, now on top of everything else will be this pollution and these health outcomes. All right, so the other thing is those analyses, the regulatory analyses, I didn't get into a lot, but the company based their work with the state's blessing on air pollution measurements from an air pollution monitoring station in the Boston area. So you might ask yourself, where is that? It's actually in Roxbury. So there's a monitor in Roxbury that's measuring particulate matter and other pollutants. And so one of the things that I'm trying to do is just ask the question, well, how valid is that as a measurement of our local air quality? And I don't think, I'm not a public health person, I'm not a regulatory person, I have a training in experimental science, I see patients, I think about the individual, I don't think about, you know, the state air quality as a whole, and the compressor won't affect the state air quality. You know, that's not what I'm thinking about. I'm thinking about the people who have to live next to this, right? That's what I want to know about. I want to go out there and measure the air pollution in the neighborhoods around the Fore River before this thing gets built. And so what we see here on the very left is it's kind of like an informal device for monitoring or measuring particulate matter pollution. And that's because the formal machines are on the order of $10,000 to $40,000. They're very expensive, they're hard to use. It's outside of my budget. But the EPA has reviewed, especially this one on the left, and said, yes, the measurements from this do correlate with the measurements from these fancy machines. So what I've done is you put this unit on a wire screen, you cover it with something to protect it from the weather, and this is again based on work that the EPA has done with these units, and then you put it in somebody's backyard. And I've been really fortunate to work with some community organizations and some people with them who have hosted these units both here and in Rhode Island, and I'm really grateful for that, and we'll see the numbers from those, at least the preliminary numbers, because these things have to stay out in the field for a long time. The analysis of the data is very complicated, but I do have some preliminary numbers that I'd like to share tonight. And these are, again, for fine particulate matter. I've been in touch with an engineer in Boston who might help me come up with other ways to monitor different pollutants. But for right now, we're looking at particulate matter. The EPA sets limits to protect human health, and this is one of the ways that these applications are supposed to protect our health. The compressor station is not supposed to violate these standards. The annual average for particulate matter of 12 and the 24-hour peak of 35. And that's easy to do because they're using these data from Roxbury. And the monitor is a federal monitor, it's a very good quality, and the numbers they get from that, the particulate matter in Roxbury is 7.2 and 16.4 for a 24-hour peak. And there are, even though there may be other sources of pollution, there are no power plants around Roxbury. So without going into too many of the details, in order to get this thing approved, what the company had to do is say, well, if we start with the background measurement and we take all of the power plants and everything else into account, and we account for our project, add that all up, does it violate this very important EPA standard? And the answer is no. So Roxbury, the average, if you add up everything, would come up to be about 8, and the 24-hour peak would be like 20, 21. Can you wait, or do you need to comment on this?
Just round out what you're saying, but excuse me, the question is, has the company, been asked to do a little study, put, north, south, east, and west, around the located? Have they been, required to do a study like this?
I have never seen that, ever. I've actually talked to the head of air resources at a state regulatory agency, and their position was that these analyses that I'm talking about here are actually very stringent and conservative, and if you were to actually go out and measure that you probably wouldn't even come up with numbers that look this bad. The real numbers would probably look cleaner, right? So that's their position. I would like to verify for myself because I'm more trained in experimental science. Okay, so now here's what we've got. Weymouth, 2 sites using this Dylos. And you look at the average, 7.62. Well, this is for the month of December, basically. It comes in pretty close to what we would expect for the Roxbury monitor, but look at that 24-hour peak. All right, so in 1 month, there was a day where the particulate matter, based on the measurements with this instrument, was 30.75. All right, look at everything we just talked about, right? I mean, this is really substantial. And now if you add on top of that, so that number is measuring the air that's already affected by the things in the Fore River area. Okay, so now we only add in the pollution that would come from the compressor station on top of this number. But that number is like about 3.5 or so for the 24-hour peak. So now you're almost violating this federal EPA standard. All right, and that is really significant. That really means a lot. All right. So again, this is just preliminary. This is, we have 1 month of data, and I've done just the most basic kind of analysis, but what I've seen is already concerning to me. And I do want to bring up work that I'm doing with another group in New England, and that is to try and do these measurements near a functional compressor station. And there is a group in New York State, a very well-organized group that's doing this work that started well before me. They've been helping me with advice, and I really appreciate their input. The Environmental Health Project, they're hosting a forum on Saturday in Deerfield. Frax or myself, we can help get you involved with that if you had the chance to drive out there. They'll talk about their own work they're doing, which is very similar. And so this is I'm using a different monitor. Here, the 24-hour peak doesn't look so bad, but the average near this compressor station, and this site is probably on the order of half a mile from the station, is almost violating the average for particulate matter. And again, this is, if you were to do those kinds of analyses for things like autism, deaths, all kinds of chronic health conditions, this is very important information. But now this brings us from the category of unknown unknowns to the category of known unknowns. And the reason is that these are not federally approved devices for measuring particulate matter. These are what I consider our best estimates. So all of the information, and I've presented almost all of it now, but all of the numbers that we've talked about tonight, these are what I consider to be our best estimates of how our health might be affected. All right? I haven't found anything better. I'll leave it up to anyone in this room or the company to come up with a better set of data. I really think this is as good as we have, the information that we've seen here. And so that being said, it might not be accurate. It might give us a general sense, but it really is, I think, our best estimate at this point. And hopefully it will get better. And hopefully some of this work will go through peer review, scientific peer review. I'm talking to people about this work, and we'll be refining it based on their comments. So now just a few conclusions before I say my last few bits. Compressor stations, I hope we can all agree, we've moved from the category of a known unknown. These are a known health hazard. And it's because of things like formaldehyde, nitrogen dioxide, particulate matter. These are toxic. They cause cancer, respiratory disease, cardiac disease, neurologic disease. And we really need to look at all of the health outcomes. Diagnosis, acute care, and death due to these pollutants. And we're left with this question: what is the actual air quality near us? Right? It takes a lot of work, a long time and a lot of work to do these measurements. The monitor in Roxbury is just sitting there. It's a fenced-in station. It's permanent. It's been there for years. Right? And so it really takes a lot to collect these data, but we have to try. So this is everything we talked about today. You know, the basics of the pipelines, the pollutants that come out of a compressor station, even though because of time constraints, I really can't get into all of the interesting details about the chemistry and whatnot. But then we've tried to look at health effects. And now the last couple things, I want to round us out and get back to what David spoke about in the beginning, the big picture, because this is more than about just health. So first of all, New England, we're facing a replacement of our coal-powered plants with these fracked gas power plants, right? We have to have these plants. There's no other way, right? That's what we hear. We don't hear about the possibility of using wind. And let me tell you, I've met with people in the States, including Governor Hassan in New Hampshire. And I haven't met with Governor Raimondo, but I'm meeting with her people. I've been invited by a community organization to meet with them. They see this as a solution, all right? But look at, we've just talked about a compressor station burning gas. And that's like a mini power plant, right? Now this is, again, from a proposal for a 1,000 megawatt frack gas power plant in Rhode Island. Tons per year, right? We're talking about like 10 to 15 tons. Look at this, hundreds of tons of nitrogen oxides. How is this clean? How is this a good replacement for coal? You know, tell me that. Carbon dioxide equivalents, this is our bridge to avoid climate change and save our children's future. 3.6 million tons of carbon dioxide equivalents each year. And those numbers, I know for a fact, those are based on estimates that look at a 100-year time frame for methane. That's not accurate, right? This is not going to be our children's lifetime. That we need to look at the 50-year estimates, which are even worse. Particulate matter, almost 200 tons a year. I don't see at all how this is, fracked gas is a clean source of electricity. So I just want to follow up my health discussion with that. And is it a bridge? A bridge to nowhere, right? This is a figure prepared by a professor at Cornell who does a lot of work studying methane. If you look at this figure, the yellow on the right is the carbon dioxide produced by burning coal per unit of electricity. And the little bit of red on top is the carbon dioxide equivalent that comes from using coal. And that's because when you dig up the coal, it releases some methane. There's this little bit of methane. But now look at on the left, natural gas. When you use natural gas to make electricity, the yellow section of that bar is the carbon dioxide equivalents that come directly from burning the methane from CH4 to CO2. And again, I didn't talk about the chemistry, but the formaldehyde is actually an intermediate step between the CH4 and the CO2, the methane and the carbon dioxide. That's why formaldehyde is important. But that red section is all of the effects of the methane that come along with using fracked gas to make electricity. All right, and I challenge you these days with what's happening in California at Porter Ranch. Tell me how methane is not an important part of the picture. All right, we're looking at releases of methane from the very beginning, from fracking through the gathering process, through pipelines, through compressor stations. The methane is being released, and if you look at a time frame that matters for us, that matters for our children, that matters for our grandchildren, we're talking 20 to 50 years, and that's really when these power plants are going to be operating, right? The next 50 years or something. This methane is going to be driving climate change even more than coal plants. So whether you talk about individual pollution or effects on climate change, these are not a replacement for coal. What we need is what we heard about in the beginning. We need renewable energy. We have to have it. And conservation, right? Nothing can prevent climate change like reducing our consumption. And hopefully, these are the things, all right, now, hopefully I've been able to convey some of my concerns tonight. And I don't want, bless you, I don't want to leave us feeling overwhelmed, although we should be moved, I think. But we also need to look at what we can do to change things for the future. And that's where I can see the Mass Save table is still outside. If you want to, if you're eligible for an energy audit for conserving your own use of electricity, solar panels or whatnot. I mean, it's a lot more than just solar panels. And if you look at this lower left quadrant, this is the stock price for Spectra Energy in the last year. It seems to have rallied a little, but it really crashed. And if you have a 401k, if you have retirement funds, if you don't know where that money is going, it probably is helping to fund the very company that wants to build this compressor station. So I would encourage you to get involved with divestment movements, like 350 Massachusetts is very active in divestment. There are people in Massachusetts, financial people, who are organizing funds for you to invest in that do not include investments in fossil fuel companies. And then the lower right corner, we have to talk to our elected representatives about why we don't want this to be built. And then finally, up here on the right, when it comes down to it and these things start getting built, we have to be out on the street and we have to make our voices heard. That's assuming if you agree with me that this is not a good idea, this project is not a good idea. But if that's the case, There's a lot to do, so I encourage you, get involved with any of the local groups who help put this together. Quincy Climate Action Network, Fall River Residents Against the Compressor Station, great organizations that I work with, and Thomas Crane Public Library, thank you for hosting this, and Quincy Access TV, many, many other people. Their work went into making this possible. So thank you, and I hope you find a way to get involved. Okay, so at this point, we'd love to have a great discussion. Maybe if we can try and focus on health for the first 15, 20 minutes, and then would certainly like to hear other people's thoughts or concerns and give people a voice to share their thoughts. Yes?
Yeah, what type of filtration or other emissions control devices are potentially available to deal with this?
So that is discussed in the regulatory filing. The company has to consider those alternatives. They could have used a different vendor for the engine. They could have used carbon dioxide sequestration, carbon capture and sequestration. They actually considered that. They had to as part of the application. There's the catalyst that I referred to. And the plan they settled on is using this particular engine with the catalyst. And I actually...
So is that like a catalytic converter in the car?
I'm pretty sure it's similar, yes. So
Can they use filters to filter out particulate matter?
I don't think that's... I can't say for sure, but I don't think that's technically feasible because of the sheer volume of pollution, right? I think it'd be really tough to filter that out.
Oh, okay.
Yeah.
Too much pollution.
Your analysis only involves 2 of the many pollutants that you had listed. Is that just because you didn't have the time to deal with all the others, or are they just the 2 most significant ones? What would happen if you included effects of all the pollutants? How much worse would things look?
Yeah. The sulfur dioxide is, and thank you for bringing that up. The sulfur dioxide, I don't think, unlike coal, is not a major part of the air pollution story for compressor stations. Carbon monoxide is, and if you look at the chemistry, the thermochemistry curves for compressor stations or burning gas from any source, carbon monoxide is a very important pollutant to come out of these compressor stations, and the amount that's coming out, I think, is relevant for human health. But that's one of these that, by focusing on these other ones, I haven't gotten to that one yet, but I plan to. And then some other things like formaldehyde, toluene. I mean, toluene is very important, toxic chemical, but we don't always have the information we need to do that analysis, which is the company projecting their emissions. It's possible to do that. You can use the same models that the EPA manages and put in formaldehyde, and you get the same concentration numbers. Put in toluene and get those. So like the power plants, this one in Rhode Island they're doing that same kind of analysis because the numbers are higher, so they have to answer the question, well, are you going to be releasing a lot of lead, a lot of benzene, a lot of toluene? And yeah, I think that's answers the question. Okay, yes?
What made them choose this location, being so populated? And are there any fallback locations they might have?
Yes, so I've heard a few different things, which I think are mostly more or less people's ideas. So one thing is it obviously has to be, it has to be on the pipeline, all right? So that's just unquestionable. The scenario that I've seen emerge in a lot of places, in New England, in New York State, places that have already had these things built or ones that are going through construction, they tend to put a compressor station with a power plant. And there's a power plant, right? That Calpine, the old Calpine plant is right there. So there may be somebody here who can speak to that, but that might not be coincidental either. Alternatives have been considered, and they have mostly been shot down.
And I was just going to speak. I'm Alice from the Fall River Residents, but this was your question. They came up, they were forced by the Energy Facility Study Board to come up with, I think, 5 or 7 different locations, most of which were absurd. They were worse than this one.
Yeah.
But one of them, which, you know, and I hate to throw Franklin under the bus, but there was an area in Franklin that's a much larger area, much lower population, blah, blah, blah. The reason that they absolutely want it here is money. It's the cheapest place for them to put it. It hooks up to what is called the hub line. There's gas now coming down from Canada, coming up from Pennsylvania, and it meets right there. They are reversing the flow to send it to Canada. This is the offshoring part of it. But that hub is the cheapest place for them to put it, and that right there is the key.
Yeah, that's, all right, that explanation, right, doesn't that makes sense?
And my conjecture of, you know, that offshore
You're right,
thing too.
yeah.
A moneymaker.
Yep, exactly. And I've heard people say, well, I heard this once, that somebody said, well, this is like their test case because most of these are built in rural places and they're trying to put one into a more populated area and see if they can get this pushed through. They would have more opportunity to expand their pipelines, et cetera. That's just something someone said to me. But the other thing I would say, you know, to go back to alternatives, all right? Do you want this in your neighborhood? No? Okay. Whose child do you want to get asthma or cancer? That's my retort to where's the alternative, right? So I sympathize with not wanting it here. This is a bad location. Absolutely. Where is a good location, right? New England is so built up. You can't put this somewhere that's not going to affect people. Sorry.
Yeah.
No, go ahead.
Sorry, you mentioned that it's Spectra themselves that submit these numbers. How often are they inspected to make sure that they peak in those numbers?
It's, yeah, I don't know, and the answer could be